Hello everyone, this is Rachel Eblin. In this presentation, I'm going to be going over what I learned about medical terminology mistakes, what I learned when conducting a personal reflection on myself, what insights I gained when I interviewed a nurse, and how I hope to make myself an asset to healthcare organizations in the future. With that being said, let's get started with what I learned about medical terminology mistakes. According to Sternberg 2012, about 44,000 patients die every year due to mistakes made by medical staff. Incorrect use of medical terminology can be detrimental to patients, therefore it's important for medical staff to be properly trained. In 2009, a woman was admitted to a hospital with gout, but was given the wrong medication, therefore she died of sepsis about 44 days later. One common mistake with medical terminology is incorrect spelling. Back in the day, we did not have all of the advanced electronic systems that we have today. Therefore, providers would make handwritten orders that weren't always legible. According to the Center for Advancement of Health, U.S. hospitals that switched to computerized physician order entry systems saw a 66% drop in prescription errors. Another common mistake with medical terminology is use of non-standardized language and abbreviations. The Joint Commission encourages healthcare organizations to use standardized terminology lists, and they introduced a Do Not Use list of abbreviations in 2004. Session 1 really opened my eyes to just how important the correct use of medical terminology is, and the impacts it can have on our patients. Next, I'm going to be going over what I learned about myself when I did a personal reflection in Session 2. In Session 2, we were asked to write a personal reflection on ourselves, and it allowed me to identify some of my strengths and weaknesses. I'm definitely more of an introverted person, and that can potentially cause challenges if I move into a healthcare administration role. During my time in the military, I have been put in a lot of stressful situations that push me outside of my comfort zone, so that has helped me tremendously. Having to brief hospital executive staff members has made me develop stronger attention to detail because I don't want to present a poorly developed project. I would definitely say that I'm humble enough to ask questions. I have worked in 5 different medical positions since joining the military, so I constantly had to ask questions so that I could learn how to be successful in all of those jobs. I'm sometimes fearful of asking for help because I'm so introverted, but I think with time it will get easier. In an article written by Laurie Langwind, she talks about how asking for help can actually reduce feelings on anxiety. As far as my confidence level is concerned, I believe that I still need a little bit of work. There are times when I'm comfortable making important decisions, but if the task is more of a high priority, then I like to seek guidance from my manager. I think a way for me to improve my confidence level when making decisions would be to continuously educate myself on my job and my programs. When asked if I would want to reside under my own care as a patient, I said that I definitely would. I really like to give 110% to my work, and I think that patients deserve this from their healthcare teams. I'm very detail-oriented, so I like to recheck my work multiple times, and I genuinely enjoy helping people. I think doing personal reflections are important because it can help us find ways that we can improve. I definitely think that with some work I can be successful in future roles in healthcare administration. Next, I'm going to go over what I learned from the medical scenario in Session 3. The medical scenario that we had to respond to in Session 3 is a situation that can be seen a lot due to long hours that organizations have their nurses working. In this scenario, a nurse was on their 4th day of working 12-hour shifts, and they administered an opioid to a patient but forgot to document that in the patient's medical record. As a result, the patient went into cardiac arrest because the nurse who took over for the previous nurse did not know that that patient already received an opioid. The first thing that led to this happening was the fact that the nurse was working 12-hour shifts and was probably exhausted. The longer a nurse is on shift, the higher the risk they will make mistakes. According to Caruso 2014, when compared with 8-hour shifts, 10-hour shifts increased the risk by 13%, and 12-hour shifts increased risk by 28%. Sleep deprivation and exhaustion can lead to a decline in neurocognitive function, therefore reducing the length of shifts could lessen the chances of medical errors. The nurse lost focus and neglected to document the medication in the patient's record, and it could have led to the patient's death. The scenario also stated that the nurse only did a quick briefing for turnover. The nurse should have given their relief a detailed status of all of their patients to include the time that they received medications. If they went over this, they might have caught the fact that they didn't correctly document medication in the patient's record. At the end of this scenario, it asked whether or not we would report it. Reporting errors when they happen is the ethical thing to do, in my opinion. According to Hughes and Wolf 2008, the ethical principles of beneficence, doing good, and non-maleficence, preventing harm, are violated when errors are not reported or disclosed. Patients always need to be put first, and I think they deserve to know when they are a victim of medical error. Next, I'm going to go over what I learned when I conducted an interview on a nurse. For my Session 4 interview, I chose to speak with Miss Rachel Perkins Gardner. She's a nurse who's working as the healthcare integrator in the military treatment facility that I work in. As the healthcare integrator, she leads our clinic in program development that integrates disease management, case management, utilization management, exceptional family member programs, clinical preventive services, and population health initiatives and interventions. She served in the Air Force for 20 years as a nurse, so she gained a lot of experience during her time. In her current role as healthcare integrator, she tracks patients with chronic diseases. Therefore, she's constantly using the terms carcinoma, diabetes, and cardiovascular disease. I then asked her about what common mistakes she encountered over her time as a nurse. She told me the biggest cause of treatment errors was due to poor handwriting and the use of non-standardized medical terminology and abbreviations. She told me that errors occurred less and less as they implemented electronic systems for ordering medications and documenting in medical records. Suckle and Hedige 2006 state that, from the patient's perspective, illegible handwriting can delay treatment and lead to unnecessary tests and inappropriate doses, which in turn can result in discomfort and death. She also talked about an incident earlier in her career where she accidentally treated the wrong patient. I asked what would have prevented this from happening, and she noted that understanding the severity of certain symptoms is important. She had a patient with shortness of breath and another patient with chest pain. She chose to treat the patient with shortness of breath first, and her patient with chest pain actually passed away from a heart attack. I then asked her what she does to prevent harm, and she talked about how she stays on top of her required training, and she ensures staff members under her are properly trained as well. I learned a lot from her during this interview, and I thought it was nice to see things from a nurse's perspective. Next, I'm going to go over how I'm going to make myself an asset in future healthcare roles. I'm very interested in working in human resources for a healthcare organization. According to Fried and Fotler 2015, human resources managers are responsible for managing the performance of employees in healthcare organizations. I want to be involved in recruiting new employees and ensuring that they are fully prepared to perform their jobs in support of the organizational goals. I really enjoyed developing and training other employees, so this would give me the opportunity to do so. If employees make mistakes with medical terminology, I could create a training plan that would help prevent these mistakes from happening in the future. I also want to have an influence on the number of hours that certain employees work. Like I mentioned earlier in this presentation, nurses are more prone to making errors the longer their shifts. I also think having influence on reducing work hours for nurses could increase retainability, which would be good for the organization. This concludes my presentation. Overall, I think I learned a lot in this class, and I look forward to using what I learned in my future roles. I also enjoyed working with you all, and thank you so much for listening.